So welcome everyone to today's session, and welcome to Giant if it's the first session you're seeing, or welcome back if you've been here for the days preceding this. Thrive have been here for 3 years now at the Giant Health Show, and we're delighted to come back again to bring new speakers to the floor, and in this case obviously in slightly different conditions. So we're really happy to have 5 sessions running at this year's Giant Health Show. And this is the last of those sessions, and we have some excellent speakers today talking about a subject that's fascinating from a theoretical point of view and in terms of how technologies are coming on board that relate to sleep and making us aware and helping us to sleep. It's going to be a fascinating conversation, I'm sure. Just a bit of intro to Thrive. We're a design and development consultancy based in the UK. And we really specialise in creating technologies that have impact in terms of health and wellness. We really look to work in a collaborative way to create new technologies that leverage sensors and data and the Internet of Things as it emerges in the health space. Really excited to talk to people who share that interest and want to connect in relation to that. So the session today will be followed by a Q&A where you'll be able to ask questions of the speakers. Please do get in touch as the discussion progresses and get your questions ready for us, and we'll try and get through them all at the end. And yeah, I think with that, I'm going to hand over to the panel to introduce themselves, and I'm going to start with Michael Larson. Would you like to introduce yourself, please, sir?
Sure. I am Michael Larson, and my interest in wearables took off when I was confronted with needing to help someone that I love very much. My daughter had a chronic health problem, and pharmaceuticals clearly were not the best option for treating her. And it was clear to me that seeking ways to leverage technology to work naturally with our body was a good way forward, and I think a way that everyone here can appreciate. I am a professor by day of mechanical engineering. I earned my PhD from MIT. And right now I have a particular interest in sleep, and whereas that might not seem to naturally go together, again, this relationship between technology and helping people naturally is motivating my interests at the moment.
Fantastic, thank you, Michael. I'd like to introduce now Rachel Wingfield. Would you like to introduce yourself, Rachel?
Yeah, great. So thank you for inviting me here. So I'm an artist and designer of experiences. I studied many years ago at the Royal College of Art, and I was looking at responsive environments. And my work was very much looking at smart textiles and integrating electronics into textiles well over a decade ago. And my interest back then, whilst I was studying, was really looking at light as medicine. So I was really researching issues around seasonal affective disorder, which I think we're all experiencing right now, and how you could use light to kind of really remedy that. So I was really integrating light into fabric. Many years down the line, I've continued to work with ideas around sort of well-being and health, and how we can create responsive environments and situations where the public can come together and engage with a scientific discourse and learn and share information around different areas of well-being, from sleep to your diet, to different ways of sort of living healthily and happily together. So a lot of the work that I do now as an artist has been through a collaborative studio called Loop.ph, and we really look at restorative placemaking, where we create these environments in which people can really relax and go through different meditation techniques, and we really look at the different ways to control the environment in order to kind of put ourselves into sort of a relaxed state and a place of kind of sharing. I've now turned my art studio, not here, it's very messy, but I've turned my art studio into a public kind of wellness place. It's quite experimental, but we run sessions throughout the week, where people can come, they can do gong baths, we do create different kind of sound and light environments. We look at sort of well-being and mindful fitness and movement. So we're just looking at wellness on lots of different levels and invite different practitioners to come and experiment So sleep is something that I'm kind of really interested in on a personal level. I've had insomnia for most of my life, and I've been trying to understand and look at different ideas around sleep, why I'm not sleeping. I've actually come to the conclusion that it's okay. I don't perhaps need to sleep as much as other people do. I'm kind of really interested in sharing what I've learnt, but it's very much from a personal perspective. How do we deal with issues around anxiety, different mental health issues and how they relate to sleep? So yeah, I'm here to sort of share my experience as an artist. So thank you very much.
Fantastic, thank you. And Lizzie Hill, would you like to introduce yourself, please?
Hi, thank you very much. My name is Dr. Lizzie Hill. I'm a lecturer in sleep medicine at the University of Oxford, and I'm coming from a slightly different background in that my background's in healthcare science. So having worked as a clinical physiologist for the last 20 years, specialising in the diagnosis and treatment of sleep disorders in various different clinical and academic settings based in Edinburgh. I'm obviously passionate about promoting healthy sleep, and I'm now a full-time educator in the field. And I'm based at the Oxford Online Programme in Sleep Medicine, which is one of the first online programmes to come out of the University of Oxford. It's been running for 5 years now, so we were slightly ahead of the game in the online teaching field. But we have a course that's a 2-year master's programme, which is open to anyone with a professional interest in sleep medicine. So as well as my role within the online programme in sleep medicine, I'm currently the education lead for the British Sleep Society, which is a multidisciplinary organisation for sleep professionals, and I'm also president of the European Society of Sleep Technologists. So I'm coming from quite a clinical and academic perspective, and also from a teaching side of things. So I have a lot of experience in sleep diagnostics, so I'm really excited to be on this very interesting panel of people with a lot of interest in sleep diagnostics today. Thank you.
Fantastic, thank you all for the introductions. What a broad panel we have. I'm really fascinated to see where the conversation goes. I'm going to start actually by asking you, Michael, because of my sort of understanding of the technologies and the sort of development of those things. I'm really interested about the measurement of sleep and what you can see when a person is sleeping. And it may be useful for our audience to kind of get a fix on that. You have a product in the market that is about sleep and about measuring sleep. I remember talking with Tim Antos at Cocoon about sleep technologies and how the intelligent kind of interaction with sleep cycles was a really sort of a hotbed for innovation. Can you tell us a bit about sleep signals and the cycles of sleep and how those two things kind of meet?
Sure. And whereas I'm sure Lizzie includes this in her course, no doubt, but for healthy sleepers, we typically go through a number of cycles regarding our brain activity during the course of a night. And a healthy sleeper will maybe have 4 or 5 of these cycles typically. And it all has to do with the rate of our brain activity. So literally across our cortex, we have electrochemical signals washing across them. And when we're awake and alert, doing something fascinating, like participating in today's session, that rate can be 40 to 60 times a second as a baseline. And as we begin to move towards sleep and we pass through that meditative state that we have all felt maybe when we're studying, we're very interested in something, our brains have those brain waves moving at about 20 hertz or 20 times a second. When it gets down to about 10 to 12, that's we're on the edge of being awake to asleep. And most people have that sensation periodically of not really knowing, am I awake, am I asleep? And it's that zone. Slower brainwave rates put us into stages of sleep. Right now, there are 3 stages of what we would call regular sleep that we can really think of in terms of that brain activity slowing. And in the deepest sleep, sometimes called delta sleep, the rate can be as low as 1 hertz. So our brains still have some activity that spans the whole range of rates, but we're looking at the predominant activity. And then the brain will speed up after slowing to complete one of these cycles that we're talking about. And right when it looks like we might be headed to wake up, we enter the REM period, which is our eyes flashing back and forth. This is when we're dreaming, and our brain activity as measured by an EEG, looking at the voltages on our scalp, can look very similar to being awake. It's that fast, but yet we are asleep. We experience some involuntary paralysis of voluntary muscles, presumably to stop us from acting out these dreams. And then the cycle starts again for a healthy sleeper. And that first REM activity happens typically, about 100 minutes nominally after we first fall asleep. And the time we spend in the deepest sleep part of the cycle is larger at the beginning of the night than at the end, because our bodies are very hungry for that deep sleep and all the good things that happen. Our tissues are being repaired. Probably what seems to be the most beneficial thing is it's during deep sleep we now know that our brains activate some cleaning mechanisms where it cleans out a lot of the byproducts of cellular activity. We don't have a lymphatic system in our brains to clear that away. So our brains literally shrink, by some estimates, up to 20%, and that allows a profusion of cerebral spinal fluid to go through our brains and wash out this stuff, which may include those beta amyloid plaques that are the hallmark of Alzheimer's. And we've got the first longitudinal studies that show a direct link between lack of deep sleep and a propensity to develop Alzheimer's. So it's very important that we get sleep. We've got to get away from this idea that it's a badge of honor to go without sleep. I worked all night last night showing what a great person I am, when in fact we will pay a price down the road for this lack of attending to the benefits to our overall health for getting sleep. So we want to encourage these cycles, and we do know that when people go without sleep, it messes up that sleep cycle pattern completely. Alcohol messes with it, so we need to understand it and help people understand their sleep better so they can change their behaviors to get the maximum benefit.
Yeah, that's really interesting. So in terms of this engagement with sleeping, it's a science and it's a necessity. But I guess the engagement with it and the narrative and the stigma around certain types of sleeping or not sleeping, or the tendency for some people to overwork and to kind of eat into that's kind of obviously one of the big problems. Rachel, I'd ask you this question in relation to your work as an artist and the engagement of an audience, I suppose, with this idea of sleep. Can you just tell us a bit about how you engage with the topic, first of all, with your audience, and then kind of how you interplay with some of the science parts of what Michael was describing?
Yeah. So as an artist, I've always been really interested in bridging the gaps of understanding and the different communities, scientific communities and artistic communities, and finding a way to, I guess, go a bit beyond like public engagement. We've been, as a studio, creating platforms in public spaces which bring scientific researchers together so that they can really share their research and engage with the public directly. One of the projects that we did was called the Cranarium, and it started off in Singapore, I think in 2016, and it was like an installation that we built in quite a busy shopping mall, and we were really looking at how we could control the environment and different environmental stimuli in order to shift people's bodies into deeper states of relaxation. So we were looking at ways in which we could control the lighting and the sound, and really looking at different frequencies and the effect, physiological effect, but also just kind of our general state of well-being. So that's kind of how the project started, and it kind of has been growing and been shown in different communities. We then showed it in Manchester at the at the Science Festival. And again, it went right into the Arndale Shopping Centre, which is an extremely busy. There's a lot of huge amount of people passing by, and we sort of built this almost temple dedicated to sleep and sharing sleep facts over there. And we had a sort of a forum and a platform to share like tips and information about sleeping, but it really became like a discussion point and a platform where people could come, they could enter this space. And what was really interesting about the work that we were doing, which wasn't really thought about in such great detail, was this sense of togetherness. And obviously when we go to bed, we're generally, some of us quite often alone in our bedrooms. It's quite an intimate, alone type of experience, and it was interesting to start doing these projects, which were where you would go into the space and there'd be like 20 other people all suspended in hammocks, being held by these textiles and being bathed in different frequencies of light and sound, and really being looked after by some facilitators. Some sleep scientists were there, and just to kind of really look after people. And this sense of togetherness was something that became quite interesting, and the socialness of sleep, which doesn't normally kind of exist. So we worked with researchers who would then had different EEG headsets. We would have some participants who would answer some questions and actually end up dedicating and being part of actual sort of research projects. So it was interesting to engage with the scientific community in this way, where it became beyond public engagement, but where we were actually helping different scientific communities conduct their kind of research. And we were just looking at how we played and controlled and did things in the environment, what kind of effect this had in terms of shifting people, through the different brain states, from theta, alpha, beta, how we can shift these different states. And we've worked with various kind of biometric sensors to do this. We've been recently looking more at meditation, meditative states, and just different ways of observing and analysing this and getting kind of biofeedback. And we've found, EEG headsets, it sounds great to be able to monitor your brain waves, and it has a very kind of nice kind of sci-fi thing. But in terms of useful data, it's quite difficult to really engage with. But we found just really looking at breath and heart rate, so using chest breath expansions and really looking at how people change their breath and how that affects their heart, and how we can look at states of relaxation. And I think looking at that actually became more interesting when we're sort of starting to talk about sleep and sleep science, really. How can we make people feel calm and to clear the mind, so that you're in a position to sleep? Because even just, for someone who suffers from insomnia, being told you must sleep, I must sleep, I must sleep, I'm not sleeping, is just, you put yourself under a huge amount of personal pressure. And it's I'm a bad person, I can't sleep, oh my God, I need to go to bed, why am I not going to bed? So it's how do we prepare ourselves for sleep? And how can we have a conversation around it, a public conversation, which is kind of less guilt driven, you must sleep, it's so important. So I think,
It's a tough one, isn't it? The psychology and the physiology, they kind of interact. Lizzie, yeah. I'd love to ask you about broader technologies. Rachel and Michael have talked about EEG as a method of measuring brainwaves and how that relates very, very closely to sleep. You're the president of the European Society of Sleep Technologists, which sounds fantastic. I want to do that. That sounds awesome. Tell us about what's out there. What can you measure in terms of sleep signals, and what's the kind of input for sleep science and measurement of sleep, and what's out there at the moment that people may or may not have heard about?
Sure. So it's quite interesting that we're talking about EEG, because the sort of traditional EEG-based polysomnography is really, when we talk about sleep technology from a clinical perspective, that's generally what we're talking about. Sleep physiologists and sleep technologists tend to work mainly with the EEG-based PSG. But there are a lot of newer technologies out there, and of course the consumer wearable market has blossomed hugely in recent years, which obviously you'll know a lot more about than I do. But things like movement are very important. We can use things like actigraphy as a a surrogate marker of sleep and wake. So when someone's moving, we assume they're awake. When they're not moving, we assume they're asleep. But then also, as Rachel mentioned, things like breathing, heart rate. There are devices out there now that use things like peripheral arterial tone, so changes in the blood pressure at the tip of the finger, as a way to measure proxy measures of sleep and sleep stages. I mean, I think what's exciting for me as a sleep technologist is how these novel sensors that are coming through from people like Michael, from engineers and data scientists, the sort of new side of things that's coming through could really revolutionise sleep medicine from a technological perspective. I guess things like artificial intelligence and machine learning are big areas at the moment which are being applied to sleep data. And I think that gives us a lot of exciting interdisciplinary opportunities to replace the traditional technologies with something quicker, easier, more reliable, easier to do in big volumes. To sit down and score an EEG-based sleep study can take anything up to 3-4 hours of manual labour to score that study. And if we can have big data, use big data sets to use AI to automate that process and take out the inter-scorer variability that there is there, anything that's based on humans interpreting physiological signals is subjective and fraught to sort of variation between scorers. So I think from my perspective, having something like AI applied to physiological data that can just take out that step for us and give us reliable automated scoring of sleep studies would be really, really important. And we've actually got a DPhil student working on this in Oxford at the moment, but I know there are lots of other people out there who are using deep learning and machine learning to automate the process. I guess some of the other exciting things that are out there at the moment, there's a new technology, a device called Sunrise, which uses mandibular movement, so movement of the jawbone, as a way to work out breathing and sleep stages. And then all of the wearables, anything that uses a sort of limited channel EEG, that's a sort of minimally invasive technique that people can use in the home. So there was a technology called the Zeo a number of years ago, which was really promising, and then kind of died a death. So I guess the sort of limited channel EEG coming through again would be really quite useful from a clinical perspective, but also could be really useful for consumers, because I think it's clear, the reason that we're all here is because consumers are really keen on monitoring their own health and their own well-being. And I think, there's lots of opportunities where the new sleep signals and novel sensors to measure sleep could have an application there.
Yeah, that's fascinating. I mean, I guess brainwaves, that's kind of the one, isn't it? That's what you want to measure. But as someone who's worked on these signals and the sensors around them, I'm struck by the starkness, I suppose, of the example of brain monitoring technologies, and just the void between what works scientifically and what consumers are willing to use. And it took me a while to find any kind of plausible consumer application in my sort of training, I guess, as a wearable tech person many years ago, until I came across sleep. And it was like, well, if the person's asleep and you've got reasonably good electrodes on them, you've got a fighting chance of taking their brain waves and getting some useful information there. So for me, sleep and EEG, that's the perfect combination. But even that, you won't get away with using wet electrodes across the head, measuring all sorts of, it's kind of a dry electrode, badly placed through hair scenario, and that's the challenge that we face in a lot of the product development we do. It's around user experience, and I think having you, Rachel, on the panel to talk about that kind of engagement, that user side of things, I want to come back to that in a moment. I'm going to ask Michael first of all, though, about that from a sort of engineering and productization point of view. What have you had challenges in that space? Wet electrode science, consumers, and consumer electronics.
Sure, a lot, and I appreciate the leading question because it is very challenging. And as you point out, not the least of which is even assuming we have something that would give quality data regarding brainwaves, it's getting people to use it. And I've had companies do professional marketing studies that included my product, which right now is a headband. And a lot of people are reluctant to put something on their heads. And it is a challenge to help them appreciate the benefit outweighs the time or perceived discomfort. And what we find is that, for a long time, people used to wear sleeping caps before central heating became ubiquitous, but they're reluctant now to wear something on their heads. And I will say that as an engineer, please know that I appreciate data, and data is very important. And it's very important, especially if we want to help people understand their health, as Lizzie says, and as Rachel made clear, sleep is about an experience, and understanding how to optimize that experience is dependent upon data. But for me, the part that I think we maybe as a community have been missing out on is the focus really is how do we help people sleep better? And it's a little frustrating when someone, say, is wearing an actigraph on one's wrist, and it tells them, you had a bad night's sleep. Well, the first reaction is, I know I had a bad night's sleep, and they put that thing in the drawer, and it stays in the drawer. And it turns out to not be a net positive for them when that's the end. And if we have this idea of we're coming at it from the perspective of, first and foremost, what do we need to do actively to help them sleep? And then ask ourselves, how does the data feed into that as a goal, where too often I think we get this notion that big data is somehow the end point. And again, that might be good for big pharmaceutical companies who are looking for ways of decreasing costs of doing an analysis of a new pharmaceutical solution. It isn't helping that particular end user. And a drawback of using many of the surrogates for brain activity, and although brainwaves sounds a little scary for the typical user, and I'd much rather just wear a wristwatch than something that's touching my scalp, what I have found through my own testing, and without mentioning any companies' names, it is clear to me that the typical mode of presenting the consumer with data about sleep is to fit a curve that simulates that type of sleep I talked about at the beginning with these cycles, and we go in and out of deep and light sleep. And then companies are using the motion data to try to figure out where the peaks and valleys, and then they present that to a user. And whereas that might be good enough for maybe the majority of people, I can tell you for those that we would like to identify in the population who have something serious going on with their sleep that maybe they should need to see an expert about, these devices can cover that up. For example, someone with narcolepsy can immediately go into that REM period of sleep and not wait 100 minutes or so before experiencing that. And a lot of these devices will not pick up on the fact that a person is asleep but having a REM period of sleep at the beginning, because it doesn't fit the curve fit that is the foundation, again, of this presentation to consumers. And I do believe that because of this, and I think it's done with the best intentions of taking what many times is an inadequate data set because you're dealing with someone's bedroom, they haven't put this thing on right. So we're doing the best we can, but it can end up being a disservice, at least, of showing someone something that maybe isn't an accurate representation of their sleep, all the way to turning them off of the notion of sleep tech, because all it does is tell me that I slept bad when I know I slept bad, or even worse, I had a horrible night's sleep, but my wristwatch tells me I had a pretty good night's sleep. Who am I going to believe in that scenario? So it is a big challenge, and I think we, again, as a community, haven't done people a service by allowing them to think that somehow from a bedside unit we can tell you how your sleep is, and we actually have done nothing to assist you in sleeping better. And I do understand when Rachel says she's not sleeping well. Every day I get messages from people who tell me that their life, the quality of life is not good because they're not able to get enough sleep, and there is this pressure to perform. And there is some research showing that blue light will indeed help stimulate the brain into thinking that, oh, it's wake time, so you should stay away from those screens at night for that input. But I believe in most cases, looking at the cell phone as you're trying to sleep, it's what's written there that is far worse than the blue light. When you see that, yes, Jacob is going on vacation again, that guy is always going on vacation. I never get to go on vacation. How are you going to sleep after reading that? Because again, you're not allowing your brain to slow down because of all the worries and cares in modern society. And what we need to think about, I believe, with wearable tech is first and foremost, how do we calm people so they can allow their own brains to slow down and get that deep sleep?
That's a great segue, Rachel, into a question for you in relation to, I guess, the broader picture of a product or a kind of piece of tech in someone's life trying to assist them. And I guess with your work, you've kind of looked at the journey of sleep and the narrative of sleep and people's perception and the social engagement of sleep, potentially. Lots of different dimensions to it because it's such a personal thing. It's such a universal thing. How can we design technologies that are sensitive enough to engage with that quantity within people's lives?
Yeah, thanks. It's a really interesting question, and thank you, Michael, for what you were saying. I think it really resonates with me. Like, how do you allow people to calm their mind? I mean, I've done a huge amount of work myself, working with different lighting suppliers, lighting technologists, and dealing a lot with light and taking probably quite a scientific and almost engineered view to the environment. But I'm very much aware that. It's how you can use technology to help people get into a place where they can empty their mind, or they can record something, or they can really prepare themselves and move away from an environment or a way of thinking which is incredibly stressful and catastrophic. And how do you calm down? So how can we use technology in a mindful way and allow people to meditate, contemplate, calm down? So I'm really interested in that use of tech. And also thinking about, this doesn't answer this question enormously, but I'm just really interested in thinking about sleep, not just for like a specific group of people, but what does sleep mean for someone who's doing shift work? What does sleep mean for someone who's like, I don't know, in a state of like constant panic and they're traumatized? What does sleep mean if you're homeless, which actually really became an issue when we were doing this project in Manchester. The biggest community and people that would come and actually use the sleep lab were homeless people, and they were just like, "Thank God, there's a safe space. I can just sleep. I only ever get 15 minutes of sleep because that's the longest I could really sleep somewhere, and then I have to move on." So I found myself speaking to this group of people that I wouldn't normally be speaking to about sleep. And it just made me think about the topic very, very differently. So how do we design society, not just technology, that allows everybody to have better quality of sleep? And there's obviously this very strong link between mental health, mental well-being, and sleep quality, which obviously perpetuates people's situations if they're getting a poor sleep. So I found that quite challenging, being there talking about sleep to the privileged people rushing about shopping. And it made me think about how do we design technology, environments, society, even for everyone really. I was looking at the sort of equality of sleep. But then also I've been doing sort of my own personal research and looking into ways in which I can use light and feedback from light. So I've been through the whole thing of collecting data, looking at the data, my data, other people's, and analysing it. But being an installation artist, I'm always really excited about live data, live feedback, immediate. You don't necessarily get that when you're sleeping, but you can get that before you sleep and when you're in this preparation environment where you're preparing for sleep. So I'm kind of really interested in kind of neurofeedbacks, biofeedbacks, which can help retrain you. So perhaps there's a way of wearing these EEG headsets or different biometric sensors, which actually retrain you, and you can go, okay, I'm doing this, I'm breathing in this particular way, I'm now shifting into this particular brain state, I'm shifting into this state, okay, now I can adapt my behaviors. So I'm really interested in how tech can be used to get immediate feedback so that you can kind of retrain and adapt and learn about what's going on in your body based on your immediate kind of experience, I guess, rather than analysing a night's data, and you don't really learn much from it.
It's interesting. You touched, or you're talking, I guess, about biofeedback and that idea of looping round many times rather than it being a kind of one shot. That's your status. Yeah. I guess. I'm fascinated with biofeedback across all sorts of products and projects that we've been involved with. I wondered, Lizzie, have you had any kind of engagement with those kind of technologies where you're not just looking at the science of sleep, but you're actually looking at cause and effect relationships? Can you affect people to improve their sleep, for example, with biofeedback? Have you been involved in anything like that?
Not particularly. What does interest me though, and both Rachel and Michael have touched on this, is about the subjective experience of sleep. And we tend to, coming from a scientific background, we tend to focus a lot on the objective measures. But actually, sleep's a very person-centered process, and it's all about how you perceive your sleep. There's no use in me sitting in a sleep lab telling someone that they sleep well if their subjective experience is that they sleep poorly. And I think what's interesting is a lot of the consumer devices will give you feedback on the quality of your sleep or the quantity of your sleep. But as Michael alluded to, if it's telling you you've had a great sleep and you know that you haven't, then that's not helpful. The flip side of that is if you're getting feedback that your sleep, if the feedback that you're getting isn't accurate, then that in turn impacts on your subjective perception. And my colleague Dmitry Gapilov in Oxford, he carried out a study using actigraphs where they were rigged to give sham feedback. So participants would get randomly assigned sham feedback that either told them, you slept for 80% of the night last night, that's great, or you slept for 80% of the night and that's bad. And that actually influenced the subjective experience of sleep for the user. So I think that type of feedback, what kind of interests me is the quality of the feedback and the accuracy of the feedback. I guess it comes back to our different backgrounds, but I always want to know that something's valid and accurate, and particularly if that can have a negative impact on our consumers or our patients or our clients. I guess the other thing is that we have this new concept now of orthosomnia, where patients become excessively preoccupied or obsessed with monitoring their sleep. And if you've got someone who's already sleeping poorly, it's quite easy for them to get into a cycle of obsessing about their sleep. And I'm sure, Rachel, you can, relate to this yourself. But someone who doesn't sleep well, they start to obsess about their sleep. And we have to be very careful with our devices, whether they're consumer devices, whether they're clinical devices. We need to make sure that the feedback that we're giving people is proportionate, that it's valid, that it's accurate. And I think we do need to be careful that we don't, actually make people sleep worse. In terms of the actual biofeedback, I've not really been involved so much in that side of things. We do have devices that are available commercially for clinical purposes, where we use things like vibration feedback to get patients with sleep apnea to turn from their back onto their side, for instance. But beyond that, I've not had a huge amount. It's really been more with it tends to be the clinician that's giving the feedback. And I think that's where our backgrounds are very different. I guess what we're looking at is consumer devices where the consumer is managing their own health rather than the clinician giving that feedback. But as I say, I think it's interesting to remember that the feedback that comes from these devices can actually affect people's subjective experience in a negative fashion. But I guess we could also harness that to try and improve their sleep. And I guess there's the whole ethics around giving placebo feedback and whether that improves people's sleep. But I guess the ethics of that's quite complex. So maybe not a discussion for today.
Maybe don't prescribe that one today. So I guess, Michael, do you have any experience with biofeedback and the interrelationship between sort of cause and effect? Or indeed, as I was listening to your answer, Lizzie, I was thinking also about stress and anxiety and how these things are quite often intertwined. Is there any way of deconvoluting stress and anxiety and comparing it with sleep? And, if you're measuring people's brainwaves, broaden it out from just the sleep factor.
Well, as far as biofeedback goes, the approach I've taken with this Sleep Shepherd headband, which it's gratifying to have lots of positive feedback from people who have used it. So when you do help someone sleep better, that is a good feeling that you get. And I will just say, Rachel, I think it's wonderful that you took time to talk to people who are homeless, because I can only imagine the extra difficulties that they have. And I love the idea of our caring about them. But with biofeedback, I do measure a simple single channel EEG. And when you're only measuring with at one place on the scalp, you do miss out on some of the wave-like behavior. So it is more difficult to get out what are just little anomalies in the signal. But for determining whether someone is awake or asleep, a single channel seems to be acceptable as long as you are getting an accurate signal, which I will also say can be problematic, again, when you're dealing with the realities of someone's bedroom and relying on them to put something on properly without help is a challenge in and of itself. Sometimes I have discovered that people were not satisfied with my product, and it came to find out they were wearing it backwards on their head, which to me is just, how can this be? There were pictures, but it's a reality that we have to face if we really want to help someone in that consumer space. We don't have the benefit of everything being in a sleep lab or on a benchtop in a laboratory, really helping people. But taking these measurements, I then play through thin speakers some very interesting binaural tones. And if you want to talk about those, I can all day, because they have a very interesting effect on the brainstem in kind of hypnotically fooling the brain into thinking that it is exposed to a periodic input when in fact none is actually being presented. And then we rely on brain entrainment, getting the rest of the brain to kind of follow in step with an external stimulus to encourage brain activity to slow down. And then using this sensor, I customize those tones in real time to try to maximize their benefit. And when someone is in deep sleep, the tones will fade away, ready to come on again. So there's that little biofeedback loop in the operation. But I also have come to appreciate anecdotally, and I haven't been able to do a study specifically about this, but users tell me that their sleep gets improved and they don't have to wear this thing every night. And as an example, my attorney, when I first started trying to commercialize this product, he was going through a very difficult time in his life. And he started wearing a Sleep Shepherd, and was actually, like many people, shocked at how much help it gave him in sleeping. And now he tells me that he doesn't wear it normally, but he finds it helpful to use, say, right before he has to be in court the next day, or he's got a big meeting and he wants to make sure that he's sleeping well. So I hope that means that there is this brain learning through biofeedback, and the brain actually is teaching itself how to slow its activity when it is sleepy time. So that is a biofeedback loop that I hope is active, and there is some research to support that idea.
Yeah, you've definitely got to the nub of it. I didn't realise quite how integrated your platform was in terms of that biofeedback loop, but that's definitely kind of a really great example. And we've done work with binaurals as well, so I know very much about that mechanism. It's fascinating and a great brain interface, that kind of technology. I'm going to run out of time, so I'm going to wind things up. I'm going to ask a question, and if you could just give me a kind of quick one-line response, each of you, if you have a thought on this. What can people do in terms of using technology to enable sleep right now? Is there something kind of obvious that they should be doing if they're struggling to sleep? Is there a product or a service? And maybe this is maybe you go somewhere else, Michael, than the Sleep Shepherd, which is an obvious candidate. But just a quick one-liner on that, if you have something to say. Let's start with Lizzie.
Put on the spot, I would say thinking about technology that's already out there and already in use. There's an app called Sleepio, which delivers digital online cognitive behavioural therapy for insomnia. It's been validated, it's in use in the NHS, and it's a great example of how we can sort of move the therapist out of the hospital or out of the office and into someone's pocket. So that would be my quick one line off the top of my head.
Fantastic, great answer. Rachel.
Yeah, there's loads of amazing sleep apps out there and ones that I use. And I mean, for me, I like to use lighting. I use the Philips Hue lighting, and I set it and I program it in the bedroom to fade through the Kelvin scale, to fade into a sunset so it gets dark. And I also couple that with using binaural and using sound within the space. I listen a lot to the work of Leo Kasendai, who's a sound meditator who helps with sleep. So I listen to his stuff before bed in a sort of darkened environment, and I find that really helps.
Fantastic, thank you. Brilliant answer. And Michael?
Well, I would just say kind of where we began. If we as individuals as society, culture, just take a different view of sleep and don't perceive it as being the thing that is expendable whenever we need a little extra time to get something done. There is no badge of honor in missing out on sleep.
Yeah, I think those are great insights from the team. And thank you so much for joining this discussion today. We're going to move to questions now from the audience, and we've got 10 or 15 minutes to look at some of the questions that are coming through. So just let me say thank you again to the panel for today's session, and we'll open the floor up now to questions.